it's not like it is not connected.
Yeah, ma'am, you live now. Can you speak something, ma'am? I'll test the audio also.
Hello, hi. I'm Dr. Kavita here. Good afternoon, good evening, everyone. I hope you're having a good day here today. And a happy Independence Day.
Yes, ma'am, it's showing. Hello. Hi.
Hello, good evening, everyone. Thank you for joining us today. And I hope you're all having a good day today and a very happy Independence Day to you all. First of all, I would like to thank Click to Click for giving us the opportunity to interact with you today, and also his chairman, Mr. Reddy, for giving us this opportunity. And also, I would like to thank IMA North, which is a very active branch of the Indian Medical Association of Telangana, and who's always been very active in supporting educational activities. So today we're going to talk about kidney diseases and how we deal with it, how to recognize kidney disease, and who are the risk of having kidney disease, and what treatment options are available there. So as you know, like any other organs in the body, kidneys are also very important to us. So we all know that kidneys do the function of eliminating or removing all the waste products in the body in the form of urine. So, but not only that, kidneys do have other functions as well. Like in terms of, kidneys are very important for us to regulate our blood pressure. So, and also to remove the excess waste in the body, and also to remove the excess water in the body. So they regulate the blood pressure, regulate the fluid balance in the body. And also kidneys produce important hormones in the body, like hormones like vitamin D is produced in the kidney. That is very important for our bones. So to make the bone stronger, you need a good vitamin D, and the kidneys are the ones that produce that hormone. And they also produce another hormone called erythropoietin. So that hormone is important for us to improve the hemoglobin. So that hormone stimulates the bones to produce red blood cells in the body and to maintain our hemoglobin. So, and also kidneys are very important to maintain the electrolyte balance, the chemicals balance in the body. So you can see that the kidneys are very important to maintain different functions in the body, like removing the waste, removing the excess salt and water, maintaining the hemoglobin, making our bones stronger, and also they're also important to making our hearts function very well as well. So that is why, so when the kidneys don't function well, it's not only that that we lose our function of removing the waste, but we also become anemic because the hemoglobin is low, and also we lose our bones, become very thin, and we can have fractures, and a heart function also will be reduced when the kidneys don't work very well. So it's very important to look after our kidneys. So how? I mean, who do you think are the risk of having kidney disease? So we all know India is a capital for diabetes and hypertension. So majority of us in India have diabetes and hypertension. So all those who are diabetic have a high risk of having kidney disease. All those who are having hypertension also will have a high risk of having kidney disease. And those, in India again, it's very common that a lot of people take painkillers. So they have some bone pains or joint pains. So just go to the pharmacy and take some painkillers. So that is the other important cause of kidney disease, that taking excess painkillers can damage your kidneys. And also there are some congenital causes. So there are some causes that by birth, so some children are born with some problems with the kidneys by birth, like cystic kidneys. So there are multiple cysts within the kidneys. So that, as you grow older, can progress and cause kidney failure. So the other conditions is that anyone in your family has any kidney disease. So it's important that you need to check your kidneys to make sure that you also don't have kidney disease. And also, again, very common problem in India is kidney stones. So those patients who are having kidney stones and also tend to have increased risk of having kidney disease. There are some people who have infections, recurrent infections, so like urinary tract infections, urine infections. So those people who have urine infections and sometimes they're neglected or not treated, they tend to progress to have kidney infection, and those are the ones who have kidney disease. So, and the other conditions can cause kidney disease, like where your body produces antibodies to your own body, like immune system is defective, and you tend to produce antibodies, and those patients can have kidney disease. So there's a number of different causes of kidney disease, but the most common cause that we see in India are mainly high blood pressures, diabetes, stones, and people who are taking regular painkillers. So these are the most common causes that we see regularly. So how do we know that we have kidney disease? So generally, unfortunately, most of the times, we will not have any symptoms of kidney disease until we are very late stages of kidney disease. So when you have any symptoms, that means, unfortunately, that we are at a very late stage. So it's very important that we recognize or we do some screening tests initially to check yourself whether you have a kidney disease. So for example, if you're diabetic or hypertension, you need to make sure, first of all, your diabetes is controlled very well. So for that, you will need to be on a proper medication to control your diabetes, either it be tablets or insulin, to make sure your diabetes is very controlled. You need to see your diabetes doctor regularly and have a sugars checked. And what we do a 3-monthly checkup of HbA1c, that should be less than 7%. So, and also every time you go to see a diabetes doctor, you need to check your urine for a protein or a microalbumin. So urine test is a must. Say once in 3 months, you have to check your urine. If you have diabetes, you're checking for protein or microalbumin in the urine. So that is the early sign of you having kidney disease. So if you have any protein or any microalbumin in the urine, that is an early sign of having kidney disease. Another way of checking is your blood test. So when you do a blood test, you check your potassium, urea, creatinine. Creatinine is a marker of the kidney disease. So that is a blood test you do. So anything that is abnormal, so depending on the lab, the normal creatinine is somewhere between 1 to 1.3, depending on the lab where you check it. So anything above the normal range of the lab, if the creatinine is high, it is again a marker of kidney disease. So always, if you have diabetes or hypertension, I would suggest that everyone should get a urine test and a blood test. For example, if you know that anyone in the family is having kidney disease, so it's always good to get an ultrasound check. For example, any cystic kidney disease where the kidneys are filled with cyst. So those patients should get an ultrasound done. So the very simple test to find out whether you have kidney disease or not, the urine test, urine is just it doesn't cost much, maximum it costs 100 rupees. So you just get a urine test to check for blood or protein in the urine. So any blood or protein in the urine, that is again a marker of kidney disease. And do a blood test to check for creatinine. So the creatinine is high, again that suggests that you have kidney disease. And an ultrasound of the kidney, of the abdomen. So kidneys are in your stomach, in your abdomen. So if you do an ultrasound of the abdomen, you will know that whether you have 2 kidneys or 1 kidney. Because some people are born with 1 kidney. So it doesn't matter. So if you have 1 good functioning kidney, that is okay. You can still have a normal life. So not all of them will have two kidneys. Some people are born with one kidney, but if that kidney is functioning well, then you will not have any problems in the future generally. So ultrasound is done to find out whether you have one kidney or two kidneys, or you can find out whether you have cyst in the kidneys. So it will tell you whether you have cyst in the kidneys. So if you have cyst in the kidneys, it's very important that you have a regular follow-up with a urine test, a blood test, and make sure, and you do a cyst follow-up as well with the ultrasounds. An ultrasound will also tell you that whether your kidney sizes, we look at the kidney size. Normally the kidney size can range from 9 to 11 centimeters. So if the size is small, that means that you have kidney disease. So ultrasound is also very important to detect kidney disease. So another way of finding it is the blood pressure. So if an young person, say someone in their 20s or 30s, is first diagnosed to have blood pressure, as I said before, kidneys help regulate the blood pressure. So if you're having high blood pressure at a young age, that is another sign, is hinting you that your blood pressure is high. That means your kidneys are not working well. Because I said to you earlier, the kidneys regulate the blood pressure. So if you have a blood pressure in the young age between 20 to 40 of age group, that means you have kidney disease. So if you have a checkup or you go to a doctor or general health checkup and you're found to have a high blood pressure, you immediately need to check your urine for blood and protein, and also a blood test to check your creatinine to see if you have a high creatinine, to see whether you have kidney disease. So coming to those with the blood pressures, so those patients who have blood pressure also should have regular, we commonly see, once they say, okay, I have blood pressure, my doctor told me, and I've been taking these tablets. And they take the tablets forever. It's very important that just taking the tablets is not enough, okay? So you have to go to see the doctor, say once in 3 or 4 months, to get your blood pressure checked. So if you're having some treatment, you need to know whether the treatment is working well or not. So every time what do we do? Whether go to the doctor, he just checks the blood pressure. No, that's not right. So you need to make sure the blood pressure is checked. So either your diabetes or hypertension or whatever reason you have high blood pressure and you're taking medication for the blood pressure, is very important to measure your blood pressure. Your blood pressure should be less than 130/80. Okay. So you don't think that, okay, I have blood pressure, I'm taking this drug, and one drug will not work forever like the rest of your life. As you get older, or as you have your kidney disease is getting worse, your blood pressure control also will get worse. And it may be that you will need more than one drug to control the blood pressure. The reason why you go to the doctor when you have blood pressure is to check whether your blood pressure is under control, like is it less than 130/80? If it is not, then will you need another medication to control the blood pressure? At the same time, you need to check your blood test and the urine test. So urine test, as I said earlier, you need to check for any protein in the urine to see, because as I said, protein in the urine is an early marker of kidney disease. So check the urine for protein, see whether you have, that will tell you whether you have kidney disease. Or you check, and also check your blood test for creatinine. If the creatinine is high, that will again tell you that you have kidney disease. So whoever is having diabetes and hypertension, you have to, every time you have to go for follow-up to your doctors, make sure your blood pressure is less than 130/80. Make sure HbA1c, that's a blood test that you do every 3 months to make sure diabetes control is less than 7. So you may ask, okay, so I have high blood pressure, my blood pressure is controlled, I have diabetes, my diabetes is controlled. Will I ever get a kidney disease? Yes. So, but you may get as you get older, okay, that you may have, it's not that if it is purely controlled that you may never get it. Some patients get complications of diabetes and hypertension, like one of the complications is kidney disease. The other complication is eye problems. Again, I see a lot of patients here don't check their eyes. So if you're diabetic, check your eyes every year, okay, to see if the diabetes changes in your eyes. Because diabetes affects the small vessels in your body. So like vessels in the eyes and vessels in the kidneys. So if you have eye disease, then there's almost certain that you will also have kidney disease. So it's very important to check your eyes test, that is to check behind the eye, to check whether the vessels are affected because of the diabetes. So coming to the medication. So over the counter, so a lot of the times we take antibiotics. We think that we have urine infection, go to the pharmacy and take some antibiotics and think that, okay, they'll work. It doesn't work like that. So taking too many antibiotics can also damage your kidneys. So do not take antibiotics without consulting your doctors. If you feel like you have a urine infection, get the urine tested. Okay, very important that you get the urine tested to see that you have infection. Get the urine culture and take the right antibiotics with the appropriate consultation with the doctors. And again, do not take painkillers. Lots of the times we've seen patients coming from, especially the rural areas, saying that, okay, I have pains, joint pains, after work I have pains. So he goes to an RMP or go to the pharmacy and they give some painkillers like Brufen, things like that. They can cause severe damage. If taken for a long period of time, they can cause severe damage to the kidneys. So do not take any medication, especially antibiotics and painkillers, without consulting doctors. So the other way is that, so these are the common cause of kidney disease, and we talked about what tests we need to do to find out whether you have kidney disease or not. So how do you know which stages? So depending on the creatinine, the blood test that you do, we classify you into different stages of kidney disease, like stage 1 to stage 5. Okay. So stage 1 is 1 to 5, as you know, mild, moderate, severe. So severe is where is stage 4 and 5. So you will get symptoms only when you are in stage 4 or 5. So what symptoms will you get when you're in the late stage of kidney disease? So the symptoms you will get is, first you will see that because your kidneys remove the excess toxins in the body and also the excess water, you may see that you will have swelling of the legs, okay? And if the swelling becomes worse, you may have difficulty in breathing because the swelling may go to your lungs, so you may have difficulty breathing. Another common symptom that you may have is that you're feeling tired all day because, as I said before, the kidneys produce a hormone to produce hemoglobin, so you become anemic and you feel a bit tired. And the toxins in the body also will make you feel tired and you will not feel hungry. So nausea is like you feel like being sick or vomiting, and you do not feel hungry. You'll be losing weight. You'll be feeling tired all day, and you'll be noticing that your blood pressure also is going high. So you're needing 2 or 3 medications to control the blood pressure, and you're having swelling of the legs. You're having difficulty breathing when you walk. Sometimes people say, I'm feeling breathless. So these are some of the symptoms that you will see when your kidneys are really bad. So do not, and sometimes, some people, as I said before, the diabetes and hypertension will get the test done, like urine for protein and a blood test for creatinine. They will know that, yes, I have some protein in the urine, or my creatinine is 1.5 or 1.6 or whatever, but I do not have symptoms. That is why I didn't go to see a doctor. So that is very bad, because unfortunately, when you come at the late stages, like, stage 4 and stage 5, as a kidney doctor, we cannot do anything. So a lot of the times it is not reversible. So if the kidney disease is because of diabetes and hypertension, and you come at a very late stages when you have all the symptoms, at that time, unfortunately, the kidney condition is not reversible. The solution at that time is to only have dialysis. So if you do know that you have some protein in the urine, or you have a blood test and your creatinine is elevated, even if it is mildly elevated, please go to see a kidney doctor. Because very important that you recognize it early and treat it early and prevent it from progressing. So if you treat early, only then you can prevent it from the kidney function to get worse. So, but again, don't go to see the kidney doctor once and say, okay, that's fine, doctor said to control the BP and the sugar, that I don't need to go and see them again because I don't have symptoms. No, that is again wrong. As I said earlier, the symptoms will only come to you when you are at the late stage of needing dialysis. So do not wait for the symptoms. However, if you know that you have kidney disease, go for regular checkups. That is only when we can try and prevent the progression. So, so intervention can be done only at the early stages. When you come at the late stages, the only solution is having dialysis. So always, you all know that prevention is better than cure. So if you know that something is wrong with your kidneys, always go for periodic regular checkups and prevent the kidneys from reaching the last stage of needing dialysis. So now, when you come at the very late stage and you're having all the symptoms and the doctor sees you and we evaluate and they say, unfortunately, but again, as I said, not all of them, even when you come at a late stage, are irreversible. If it is due to diabetes, hypertension, or if it's drugs related, or if you're having some congenitally something wrong with your kidneys by birth, so those are the conditions which are not reversible. But there are some conditions, as I said before, like there's autoimmune conditions where you're producing antibodies to your own kidneys. So those are the conditions, sometimes you can treat them and they can get better. But majority of the time, patients come to us at the late stages. So when you come at the late stages, the treatment options, when we think that there's nothing we can do to make your kidneys better, so the only option is to have dialysis or transplant. Now, again, one other thing I noticed here was that when you have a kidney problem, people are scared to go to see a kidney doctor because they think that, oh, if I go to see a kidney doctor, they'll only tell, okay, I need dialysis. No, that is not what we tell. So we are here to try and prevent you to reach the stage of dialysis. Okay. So, so if you come early, we can do something early to prevent you from going to need dialysis. But unfortunately, majority of the times we see patients coming in the late stages, and again, when they come the late stages, we then advise that that they may need dialysis. It is very early. It's important that preparation for dialysis also takes time. So I understand when suddenly you come to see a kidney doctor with all the symptoms, and the doctor tells you that you need dialysis, it's a big shock to you and your family. I understand it takes time, but for you to understand what is dialysis, how to modify your life around dialysis. So life, you have to, your lifestyle will change, okay, depending on what treatment you choose. So again, if any doctor tells you that, okay, you are at this stage of kidney disease, you may need dialysis in the next 3 or 4 months or so, you have to listen to that, because sometimes we see that, okay, I will come back whenever my symptoms get worse or when I really desperate to need dialysis. That's not right, because when you come at the, again, very late stage, that we have to do emergency dialysis on the day you come to the hospital, the outcomes, so you don't do very well. People who start dialysis at a very late stage, like an emergency dialysis, they generally don't do very well compared to people who start dialysis early in a planned fashion. So when it comes to dialysis, preparation is very important. Preparation for you and the family, understanding what different types of dialysis are there. There are 2 types of dialysis. There's one that can be done at home, one that can be done at hospital. So the choice of whether you want which type of dialysis is done by the discussion with your doctor and your family and your lifestyle or where you live. So both the dialysis are equally good. So the choice of which dialysis is good for you will be decided by the doctor, by your family, for you, and whether you're working or not. So we have to discuss this. So it needs a significant discussion between the doctor, your family members, and yourself, not only in one session. So it needs several sessions of consultation to discuss and come to a decision of what types of dialysis you need. So once you choose that I want to dialyze at home or one in hospital, you have to start preparing. Okay. So the preparation again takes 3 to 4 months. So that is why it is very important to keep in touch with your kidney doctor for you when you reach the stage of needing dialysis. So the preparation is where you need some education. So when you come to the stage, you need lots of changes in your lifestyle. For example, you need to have fluid restriction because your kidneys are not working very well. You can't drink much. You probably need to, depending on how much urine you're passing, you can only drink maybe 1 liter a day. You need to, salt restriction is very important. So salt is like 2 grams per day. So depending on your blood test, your potassium levels, your calcium, your phosphorus levels, the doctors will advise you regarding any change in your diet. So lots of changes have to be made in your lifestyle in terms of, exercising, changes in your diet. If you're smoking, you need to stop smoking. If you're drinking, you need to stop drinking. So you need to drink less water, say 1 liter a day. You need to stop taking salt or very less salt. You need to change some of the food that you cannot have. So all this you need to change in your lifestyle, and that again will need a lot of education from the doctor, from the dietitian, and all this you need to do to start preparing for dialysis. So if you choose to have dialysis in the hospital, then you need to have a small operation that we call create a small fistula in the hand, so that from there the blood is taken, passes through the machine. The machine cleans the blood of all the toxins and gives back the blood to you. So dialysis is basically trying to simulate the function of the kidney by removing some toxins from your body, which your own kidney is not able to do. So it removes the toxins and removes excess water in your body. So that is how dialysis works. So dialysis roughly gives you additional 10% of the kidney function to your original kidneys. So it is not like because you're on dialysis, I'm getting 100% kidney function. No, it only adds to 10% of the function, which is okay to survive. Okay, you can still have it. So again, there's a myth that dialysis is like a death sentence. No, I tell patients in and out every day, it is not like a death sentence. So people who are on dialysis can lead a very active lifestyle. They are CEOs of companies on dialysis. There are people who work 12 hours a day on dialysis. So you can continue to work, continue to live a normal lifestyle, making some small adjustments in your life or in your working hours in order to facilitate the dialysis. So do not think that dialysis is like a death sentence and, oh, I'm scared of dialysis, I don't want to have dialysis. If you take your dialysis regularly as instructed by the doctor, like 2 or 3 times a week, follow the dietary restrictions, follow the fluid restrictions that you will be given by the doctor, and follow the diet and take regular consultations with the doctor, you can still lead a very active lifestyle on dialysis and continue to work if you're already working. The other option of other treatment options that is there apart from dialysis is transplant. So transplant is where, because your kidneys are damaged, you are not able to remove all the toxins from your body and excess water. You get an extra kidney from your relative, or someone who's died and willing to donate kidneys. So where you replace one good kidney, when you put one good kidney in your body, and that does function, that's a good normal kidney, so that takes over your function of your kidneys, and again does a normal function where you don't need dialysis. So all this, so the options available are dialysis and transplant. So you can have any of the option depending on your choice, or depending on availability of a donor, or depending on where you live also matters. So at the same time, don't think that, I got a transplant and I can live whatever. So either dialysis or a transplant, you have to have some discipline in your life, like in terms of dietary restrictions, fluid restrictions, taking regular medicines, seeing the doctor very regularly, and again changing in lifestyles, like less salt in your diet. If you're smoking, you need to stop smoking and stop drinking. Exercises again is very, very important. So just coming to the dialysis, having dialysis and going home, that's not important. That on its own does not help you. Exercising, dietary restrictions, taking medicines, all that together will make you lead a very happy and active lifestyle. So, so it's very important that you follow the instructions and keep in touch. If you know that you have kidney disease, please keep in touch with your kidney doctor and have a regular follow-up. Say, depending on the level of kidney function, they may say 3 months, 4 months, or if you are at a very late stages, sometimes you may need to go into the doctor every month. So all that we are doing here by you coming to see a kidney doctor is trying to delay the progression of the kidney disease. So there are lots of studies saying that if someone who has been seeing the doctor regularly can delay the progression of the kidney disease, can control the kidney disease, and delay the need for dialysis or transplant by a number of years. So follow the instructions and be disciplined. See your doctor regularly. Keep an eye on your blood pressure. Check your sugars at home. Exercise. Stop smoking. And if you're drinking, stop drinking. And do a blood test. And keep an eye on the kidney functions regularly. So these are the ways that you can try and prevent progression of your kidney disease to the late stages and prevent dialysis. So I'm going to stop here, and I hope I was a very brief introduction about kidneys and how to take care of the kidneys. So, and we're going to see if you have any questions, you can please post here, and then we can discuss and see how I can help you with answering some of the questions here. So there was one question here from Mahendra saying that I go to the bathroom frequently. Does that mean that my kidneys are working? Doesn't that mean my kidneys are working normally? Okay. So one of the symptoms of the kidney disease is that some people notice that people who have kidney disease go to the bathroom very frequently in the night. Okay. So again, those people who have high blood pressure, if the blood pressure is not very controlled, you will notice that they tend to go to the bathroom very frequently in the night. Okay. So, and also people who have kidney disease, creatinines are very high, they go to the bathrooms more frequently in the night. So it doesn't mean that you're passing urine normally, doesn't mean that you do not have kidney disease. Okay. So people who are on dialysis also pass urine. So varying depends on, they may pass up to 1 liter, 500 ml, or some people will not pass urine at all. So passing urine, it doesn't mean that you do not have kidney disease. So there's some people, you know, as you grow older in the men, the prostate becomes big. Okay. The prostate is a gland that is present in the urinary passage. So if the gland becomes big, okay, so that is causing blockage of the urinary passage. So they will not empty the bladder frequently. So what's happening is that because the gland becomes big, it blocks the urinary passage. Every time they go to the urine, the bladder is not emptied completely. So those patients go to the toilet very frequently. So for example, every hour they have to go to the toilet. So because the urine is not emptied completely and there's urine left in the bladder. So again, if you neglect those symptoms, you will end up with having kidney failure. So anyone who is passing more urine more than 3 times in the night, you need to consult a kidney doctor, because if you're male and if you're elderly, like say more than 65 or so, it could be that you have a prostate problem because your prostate gland is big and you're not able to empty the bladder properly. So that is the other reason why you may have kidney problems, because of the blockage to the system. So in those patients, how do you find out? You do an ultrasound to see whether your prostate is big, and also to check whether your bladder is retaining urine. So in those patients, most cases, you can rectify the problem with medication. So you can reduce the prostate size with the medication, and you can rectify the problem. But in some patients, if you come at a very late stage and the prostate is too big, become too big, and you're not able to empty the bladder, and it's affecting your kidneys, so sometimes they would need surgery to remove the excess prostate gland to allow the urine to pass completely. So if you're passing very frequently urine on the night, so please consult your doctor and check your urine test for blood and protein, do a blood test, check your creatinine, and do an ultrasound to check your kidney size and also your prostate gland to see whether it is enlarged, and also to check whether your bladder is emptying properly. So it's very important that you go for checkups. So it doesn't mean that if you're passing urine, I do not have kidney problem. No. So you will still need a checkup. So there's another question from Siva Sankaran saying my creatinine level is 1.4. How to reduce the creatinine level? Okay. So creatinine is a blood test, which is a marker of the kidney disease. So, if your creatinine is high, first of all, you need to find out why it is high. Okay. So as I said before, you need to check, are you having any protein in the urine? So are you having any blood or protein in the urine? If you have a blood, you do a urine test to check if you're having blood or protein in the urine. Okay, so if you're having blood or protein in the urine, so that means there's something wrong with the kidneys. So that's leaking. Normally, if your kidneys are normal, the filtering units of the kidneys are normal, you will not see any blood and protein in the urine. So if a normal healthy person, if you do a urine test, there will be no blood and protein in the urine. So if someone has a urine test and has seen a blood and protein in the urine, that means that they have something wrong with the kidneys that are leaking blood and protein in the urine. So you get a urine test to see what's happening in the urine, the blood and protein, and get a blood pressure test to see whether you're having high blood pressure, get a sugar test to see whether you're having high blood sugar or whether you're diabetes, and get an ultrasound of the kidneys to see whether you're having any normal sized kidneys, or you're having any problems with the kidneys or the prostate or anything like that. So depending on the cause of why your creatinine is high, say it's 1.4, slightly high, depending on the cause. Say if you're taking any painkillers, so you have to stop that. So, or if you're taking some antibiotics regularly just by the counter, so you have to stop doing that. So depending on the cause of, first of all, as I said, do all this test to find out what is the cause of your high creatinine. So once you find out the cause of high creatinine, then we have to treat the cause. So how do you reduce the creatinine level? So if you're diabetic, you control your diabetes. Okay. So by controlling the diabetes, you are preventing the complications of diabetes, which is one of the complications of diabetes is diabetic kidney disease. So if you have high blood pressure, you control your blood pressure with medication. You change your lifestyle. So if you're obese, you have to lose weight. Okay. So obese means overweight patients tend to have increased risk of kidney disease. So you have to exercise and lose weight. Smoking, again, stop smoking and stop drinking. So that is how, by changing your lifestyle, by controlling your diabetes, controlling your blood sugar, and controlling your blood pressure, and finding out the reason of why you have kidney disease, and take medications appropriately depending on the reason, that is how you reduce the creatinine level. So, so it all depends. Find out the cause. So to why your creatinine is high, and based on that, you reduce the creatinine level. So any other questions that we have here? So again, I emphasize that the whole point is that if you do know that you have abnormal creatinine or abnormal urine protein, abnormal protein in the urine, please, have regular checkups. So lots of the times we see that a lot of patients come at a very late stage. So again, and end up on dialysis. So whilst you're on dialysis, some people think, some people dialyze in places where there are no doctors. Like lots of times in rural areas, a government has set up some dialysis centers in the towns where there are no doctors. Okay, so and majority of the time it is led by the technician. So it's okay if you're dialyzing there, but you make sure that you come to see your doctor once every month. So you will need to be monitored on dialysis, see how much fluid that you need to remove on dialysis, what medication that you need to take while you're on dialysis, some injections that you need to take to improve your hemoglobin levels, some tablets you need to take to improve your bone because your vitamin D is low, and how to control the excess fluid in the body. So all that you will need to see a doctor regularly if you're on dialysis to for take appropriate medications, to see how much fluid needs to be taken on dialysis, and and how your heart is. So dialysis patients generally tend to have other effects on the other organs of the body, like the heart. So if you do not have proper dialysis, there's excess fluid in the body, and that will put a strain on the heart. So the heart will enlarge. So most of the patients who are on dialysis don't die because of kidney problem. They die because of heart problems. So they end up having heart attacks. So any patients who have chronic kidney disease, anyone who has high creatinine levels will have a high risk of having heart attack. So that is the other reason why your diabetes, hypertension, you have kidney disease, you are 10 times at a more risk of having heart attack compared to someone who does not have kidney disease. So that is why it's very important that you control your blood pressure and your sugar levels, and you will need some medication to try and protect your heart. So that is very important. So people on dialysis die of heart problems. So that's why you need a regular follow-up because of that. So again, lots of the times we see patients, say they have some burning sensation in the urine, and they go to the pharmacist and say, I need some antibiotics. So again, it's very important that you have any urinary symptoms, get a urine test done to see urine cultures done. Because if you're taking a lot of antibiotics and without proper knowing whether they're going to work or not, they're going to, when we really have a kidney disease or when you really have a urine infection, they will come to a stage where you have difficulty taking antibiotics because no antibiotic will start working on you because you've taken multiple antibiotics before. So you develop this something called drug resistance. So it's very important that you get your urine tested and take antibiotics depending on the doctor's advice rather than taking your own antibiotics. So let us see if we have any questions here. So there's a question from Deepak Khanna. Dialysis at home equipments have started. Are they safe? Under nursing stuff, many corporates are doing now. Yeah. So dialysis at home can be, as I said, there are two different types of dialysis which can be done at home. So one is peritoneal dialysis. So where here they put a tube in the stomach, and there's a fluid bag, the 2-liter bags, where you attach the fluid bag to the tube in the stomach, and the fluid goes into your body and stays in your stomach for 4 hours. And after 4 hours, you empty the fluid. Okay. So that needs to be done 3 to 4 times a day and every day. Okay, so that is relatively easy to do. And if you ask me if people are able to do that at home, I would say to start off, that would be the best form of dialysis to start off. Okay, so because that type of dialysis is that you can stay at home, you can do it yourself, and mind you, there'll be enough training done for you to be able to do this at home. So people will at the hospital or your doctor will train you how to do it at home. And when they're happy that you are able to do it at home, that you're trained well, then you'll be able to continue to do it at home. But it has to be done every day, either 3 to 4 times a day. And it is safe enough to do, and you don't have to come to the hospital. And people who are on this type of dialysis at home is like tend to maintain the kidney function much longer than people who are on hemodialysis, like doing the dialysis at the hospital. So yeah, so I understand again the hemodialysis which is done at home. So at a hospital where it's done to the machine, where you have to do it 3 times a week, and each time is 4 hours. So the blood is taken out. As I said, the fistula is done, the blood is taken out, and then it is run through the machine, and the machine cleans the toxins and gives back the blood to you. That has to be done 3 times a week and 4 hours each time at the hospital. But now there are some hospitals or there are some centers which are providing this machine at home. So if you are able to have a home setup, if your home is, because obviously you need one room for that, and if your home is big enough, you have an extra room, and you're able to accommodate this machine at home, yes, you could have this type of dialysis at home as well. Again, you can do it 3 to 4 times a week. In the West, okay, we encourage patients to have home dialysis, and patients sometimes train themselves to do their own dialysis. So those patients who are educated and able to do the dialysis at home, we encourage them to do at least 4 to 5 times a day, maybe 2 or 3 hours a day. That is like simulating your own kidney function. And those patients who are able to do dialysis daily, at least 2 or 3 hours a day, tend to do much better than doing this intermittent dialysis like 4 hours 3 times a week, because the gap is less, the toxins are removed very easily. Every day the toxins are removed. So yes, if you're able to do at home dialysis, it is safe, provided that you are confident that you're trained enough, and provided that you're confident that you're able to do at home. I think that is probably the better form of dialysis. Now, there's some question that if children go to washroom immediately after eating food and passing stool, is it normal or indicates some kidney issue? Yeah, that again, I think you need to be very specific about what you're asking, but I don't think that matters. But if the children complain of the children are passing urine in the bedwetting beyond the age of 7 or 8, and they're passing urine in the bed very often, or if they're having regular urine infections, or if they're having difficulty, swelling of the face or swelling of the body, and that indicates that they have kidney problems in children. There's another question from Jed Mohan. Does Sjogren's syndrome make kidneys more prone to damage and less immunity? Yes. So Sjogren's syndrome is like an autoimmune syndrome. It's like where your bodies are producing antibodies to your own body, and that is affecting your joints, and it also affects the blood vessels. The kidneys are full of blood vessels. So people who have Sjogren's syndrome, yes, they're more prone to have kidney disease, and also they're more prone to have hypertension. So you need to check your blood pressures, and also you need to have regular blood tests to check your kidneys, and also urine, you need to check for urine for blood and protein. Okay, there's a question from Shivasankaran asking, what is the last stage of creatinine level? Yeah, so there's a misnomer here, that there's a myth, I would say, that creatinine is level of creatinine is will tell you the stages of your kidney disease. So creatinine, as I said to you, is coming from your muscle mass. Okay, so if you're young and fit, have a good muscle mass, you may have a high creatinine. So, but if you're old, if you're above 80-year-old, you don't have muscle mass, so your creatinine may be less. That doesn't mean that if you have creatinine is like 2 or 3 or so, it doesn't mean that you're not in a late stage of kidney disease. So the stages of kidney disease is calculated based on the creatinine. We come up with the equation, putting your creatinine, your age, and your sex, like your male or female, your age, and your creatinine level. We come with you put that in a formula, and you come with the figure called GFR. We measure the GFR, and that will tell you what stage of kidney disease you're on. So as I said, there's stage 1 to 5. So if your GFR is less than 15, so you're at a late stage of kidney disease, like stage 5 of kidney disease. So, so depending on the creatinine, we calculate what stage of kidney disease is you are at. Okay, so there's no like creatinine, there's no level of 6, 7, or 8. Is it late stage? No. It depends on what your GFR is. We tell you what stage of kidney disease you are at. So there's a question from Sunil saying, are kidney transplant patients more prone to COVID? Yes. So when you're having a kidney transplant, you're taking kidney from another person. So that is like a foreign thing to your own body. So to prevent that, your own body recognizing the other kidney as a foreign body, we give a lot of medication to reduce your immunity. So like very high dose of immunosuppressants are given to reduce the immunity in your body, to accept that kidney into your own body, so that you don't reject that kidney. We give a lot of medication, high dose medication called immunosuppressants. So, and also that once you have a transplant, you will be on a lifelong medication to reduce the immunity in your body, so you don't reject that kidney. So immunity for transplant patients is generally low because of this medication that you take. So yes, so transplant patients are very high prone to have COVID. So you do need to take precautions, like majority of the times we tell them not to get out of the house until necessary. Follow the precautions like wash your hands, social distancing, use a mask, take your medication regularly. If you're feeling unwell, you consult your doctor over the phone. Nowadays, there's a lot of teleconsultations and video consultations. So consult your doctor over the phone very promptly. So you need to take all the extra precautions because you're on this medication that reduces immunity. So yes, transplant patients are a very high risk. So there's another question, Saurabh, how naturally we will maintain our kidney healthy? Okay. So as I said, so you just have to lead a very healthy lifestyle in terms of exercising regularly, minimum 30 to 45 minutes a day, stop smoking, eating healthy food, eating less fatty food, stop smoking if you're smoking, stop drinking, drink plenty of water, 3 to 4 liters a day, and have checkups regularly, go for annual checkups to see whether you're diabetes or hypertension, and take medication to control if you're diabetes and hypertension. So just generally leading a very healthy lifestyle, and don't take any medication like painkillers, over-the-counter medication like antibiotics or painkillers, and having regular checkups. You can maintain your general health and also your kidney condition. So there's a question from Saloni Sharma. How does aging affect the health of the kidneys? Yeah, it's a very good question. So generally, we say that anyone above the age of 40, so like a natural process of aging, as you age, your organs in your body also age, so they also get tired working hard. So once you're above 40 or so, we say that we lose even healthy, normal individuals lose about 1% of the kidney function per year. Okay, so for example, we say the kidney function normally should be around 90 to 120%. That is the filtration rate, 90 to 120%. So say if you're at 90% functioning now, so once you're above 40, you lose 1% every year. So that is how aging affects the kidneys. So if you're 70, okay, so you lose 1% every year. So 30 years, you lose 30%. So if you're 90, so you become 60 when you're 70. So like that. So aging does affect the kidneys. So there's a natural progression of aging. Okay. So there's a question from Jaya Balan. My creatinine is 4.3 and having blocks in the heart also. Is there any chance of regeneration of kidneys to a better level? So again, as I said before, it depends on why is a creatinine 4.3? Depends on the condition or the disease that you're having. Is it because of the high blood pressure? Is it because of the diabetes? Is it because any other? So any chance of regeneration depends on the condition of the why you have the kidney disease. So your underlying cause. If it is because of diabetes and hypertension, I'm afraid, unfortunately, the damage is already done. So you have to control the diabetes and hypertension and also your heart to maintain at this level. Okay. So it all depends on what is the underlying cause of kidney disease. So so the chance of regeneration again depends on underlying cause of kidney disease and something that you need to discuss with your doctor who's seeing you of why you have kidney disease and what are the precautionary measures that you can take to prevent its progression. So okay. So I think a lot of people get scared to, when someone says, "Oh, my kidneys have failed." So I think you do need to be brave enough, and it's very important that you consult a doctor and take the necessary precaution that they advise, and come to regular follow-up. And what I notice is majority of the times, a lot of patients come when the creatinine is 1.6 and 2, and I never see them again, and they come after 2 years, oh, my creatinine is 4. So we cannot, as I said, it's very important that you try and, be in touch with your doctor to prevent the progression and take the necessary precautions. All of them are not irreversible. Some of them, if we catch them early, yes, they are reversible, okay, depending on the condition. Again, kidney biopsy is something I want to touch. See, for example, you get some checkup done and you notice that you have urine bladder protein and your creatinine is slightly high or even still normal. Okay, even some occasions creatinine can be normal, but in the urine test, if you have blood and protein, that means you have a kidney disease. Okay, and that you're fortunate that it was picked up early. In order to find out why you have blood and protein in the urine, it's important for you to have a kidney biopsy. Okay, again, I see that, sometimes when I mention biopsy to the patients, they get scared, they think, oh, it's such a big thing, and they never come back. So you miss the boat there, because biopsy is a very simple procedure where you do an ultrasound to check your kidneys, and with the help of ultrasound, you take a small piece of tissue from the kidney, and once the procedure is done, you rest in the hospital for 6 hours, and if you're well, you go home the same day. Generally speaking, we do lots of biopsies most days, and we do not have any complications. So do not think that biopsy is a major procedure, will have complications. Oh, I'm not scared of having the biopsy. A biopsy is very, very important to find out why you have kidney disease. Is it reversible or not reversible? What medication can the doctor give you to treat your kidney disease? And it can tell you how is the future kidney disease going to be. So it will give you lots of answers to help you and the doctor decide what treatment we need to give for your kidneys to make them better. So if you consulted a doctor and mention that you need a biopsy, you please go ahead and have the biopsy, because that is going to help you to treat your kidneys to make them better. So do not be scared of a biopsy. It is a very simple procedure. We do it regularly and it is no major complications. So there's a question here from Jayabalan saying that doctor has prescribed me sodium bicarbonate. How does that help? Okay. So as I said, we spoke earlier that kidneys have multiple functions in your body, okay? Like regulating blood pressure, removing excess toxins, and the toxins here is the acid levels. So they remove the acid levels, excess acid levels in the body, like uric acid, ammonia, is removed by the kidneys. So when your kidneys don't work very well, those acids are accumulated in your body. So the sodium bicarbonate tablet is an alkali tablet. It neutralizes the acid levels in your body. It improves the alkali levels in your body. So that is how it helps. So if the acid levels in the body are very high, you'll feel like, nausea, like vomiting, no appetite, your bones become very weak and have fractures. So the sodium bicarbonate tablet is going to improve the acid levels in your body, make them less, so that you don't have any major effects on your bones, and they make them feel better. So that is how they're going to help. So again, unfortunately, someone who has kidney disease will need to take several tablets, because one of them is like, as I said, the acid levels in the body are high. So to neutralize the acid levels, you have to take the sodium bicarbonate tablets. Your blood pressures will be high, so you will need to take 2 or 3 tablets to control the blood pressure. Because your kidneys are not working very well, your blood pressure becomes difficult to control. So you will need 2 or 3 tablets to control the blood pressure. If you're diabetic, you will need to take tablets for your diabetes. You will need to take medication for your bones. As I said, the kidneys produce vitamin D. So vitamin D is lacking in your body, so you need to take vitamin D tablets. You need to take hormone injections to improve the hemoglobin levels. So as I said before, the kidneys produce a hormone to produce your RBC from the bone. So that hormone is lacking. So you need to take, that has to be taken like insulin. You know how you take insulin? Like under your skin. So you need to take that erythropoietin injections to improve the hemoglobin. So, and you will need to take, so for example, if you tend to have heart problems, you need to take some medication for your heart. So you take some aspirin if you're diabetic. So generally, kidney patients who are on dialysis will tend to take generally about 6 to 7 tablets or more a day. So each tablet is, one is for hemoglobin, bones, your heart, your sugars, your blood pressures, So it's very important that you take all the tablets and maintain a healthy lifestyle by taking the tablets, consulting the doctor, and having regular dialysis. The other thing we notice is sometimes, patients on dialysis tend to, not come regularly for dialysis for a variety of reasons. Okay, for example, usually is advised thrice weekly. So majority of some patients may not come because of logistic reasons, it's too far, or there's no one to pick up from home or something like that. So, but we tend to say that if possible, go for 3 times a week, because twice a week dialysis may not be enough. Say if you're passing urine like 1 liter or more, so it may be okay to have twice a week dialysis. But if you're not passing urine, it's very important that you have 3 times a week dialysis to maintain your good healthy function. If you do not have dialysis regularly, all the toxins are going to have an effect on your general health and a majority of the times on your heart. So the more, as I said before, so dialysis patients don't die because they don't have dialysis, they die because they have a sudden heart attack. So it's very important to have dialysis regularly and be in touch with your doctors. So I think we are almost done with the questions. We probably are okay now to end the session. So thank you all for joining us today, and I hope you found it informative. And if you want to get in touch with me, you can get in touch with me through Bright Kidney Center website. And take care, stay safe, stay at home, and be in touch with your doctors regularly. So, so those patients who are having kidney disease, do not, be in touch with the doctors regularly. Now, if you do not like going to hospital, that's okay, but there's video consultations, online consultations, and please check your creatinines regularly, at least every 3 months, and be in touch with a doctor. And because if you do not be on regular touch with a doctor, you cannot get your blood test done, you may end up having emergency dialysis. So do not come to the situation. So have a regular test and be in touch with a doctor with online consultations, and take your medicines regularly and take care of yourself. And those on dialysis, please go to dialysis regularly. Most hospitals are safe to have dialysis. There are regular testing being done. So do not miss your dialysis. So you do not want to end up in an emergency situation and risk your health. So take care, stay safe, be in touch with your doctors. Thank you all. And I thank Click to Clinic and Dr. Reddy is chairman, and also IMA North for giving us this opportunity today. And see you again. Thank you so much. See you.